Good afternoon and welcome to another episode of Let's Talk. I'm your host, Dr. Celeste, MD, and today we are talking about breast cancer. It is Breast Cancer Awareness Month, this month of October, and although we are going and discussing a lot of other different issues that are awareness topics for the month, including bullying, which we'll have the second episode of that on this Friday at 12 noon, today we're going to talk about breast cancer. On our last episode, we talked about mammograms and the importance of getting a mammogram and the importance of detection with that, both for men and for women. Oftentimes we know that breast cancer most commonly affects women, but it's very important that we note that men can too be affected by breast cancer. So just trying to increase our awareness in this area. We are coming to you live today from Birmingham, Alabama. It's a dreary day. It's supposed to rain today. It hasn't started raining just yet, but we probably need to be prepared just in case. We need some rain at this point anyway, because it's been so dry and so warm, even for it being fall. So we're going to not delay and go ahead and get started. Thank you for those of you who have taken the time to tune in. If you are watching this in replay, I would ask if you would please put hashtag replay in the comment section. If you have any questions, feel free to put those in the comment section as well, and we'll go ahead and get started. With our last episode, we talked about mammograms and the importance of getting a mammogram and at different ages. Women that are 40 years old and older generally need to go ahead and start having their mammograms done. If you are a man, especially if you have family history of breast cancer, very important for you to do a consultation with your physician to determine whether or not you are in need of a mammogram, because men do get breast cancer. So let's talk about breast cancer. Some of the symptoms of breast cancer include noticing a lump or a bump in your breast tissue or in your underarm area. You may get a bloody discharge from your nipple. You can have changes in the shape or texture of your breast or of your nipples. Some people complain of having just breast discomfort. Some patients may complain of having an inverted nipple, in addition to having a flat or an indented area in the breast. So if you're having any of these symptoms, these are something that you need to bring to the attention of your physician and make sure that you go in for an exam right away. We always recommend that women do a self-breast exam every month, preferably after the cycle when the hormones are no longer causing the normal changes that we can see in breast tissue. You want to just make sure you do that once a month after your menstrual cycle. So after a breast cancer is detected, whether by mammogram, you may go on to have other imaging done, like a breast ultrasound or even an MRI. There is something called staging that is done to determine the treatment plan for the breast cancer. And in that, some of the staging details whether or not the breast cancer has spread to other areas. The most common places that breast cancer will spread include the bone, your liver, your lungs, or even your brain and your lymph nodes. So let's talk about some of the risk factors that exist for breast cancer. There's some risk factors that there's nothing that you can do about. It's nothing that you can change about these things. The first risk factor we want to talk about is getting older. As we get older, your risk of breast cancer increases, especially over the age of 50 years old. Now, the one caveat with that is that doesn't mean, I can't get breast cancer until I'm over the age of 50. No, that is not true. Women definitely are being diagnosed with breast cancer in their 40s and even in their 30s. So starting the screening at the appropriate time is very important, but we're just saying that it's more common for breast cancer to be diagnosed in women and men that are over the age of 50 years old. So next risk factor, that you can't change is your reproductive history. If you are a person who has had early menstruation, or you started your cycles before the age of 12 years old, or you're someone that has had late menopause, which would be after the age of 55 years old, you've been exposed to the hormones for longer, so it increases your risk of having breast cancer. Next, family history. If you have family history of changes to a particular gene, there's something that's called a BRCA1 and BRCA2, and this is a breast cancer susceptibility gene that when it's a normal gene or normal DNA, it acts to restrain the growth of cells in the breast tissue. Now, if that gene has changed or is mutated, then it's known to predispose individuals to having breast cancer. Hello, Mr. Cannon. Thank you so much for joining us. So patients that have this gene in their family, the BRCA1 or the BRCA2, are at increased risk for having breast cancer. Having dense breasts is a risk for having breast cancer. In addition to that, having family history, if you have a first-degree relative, whether that's a mother, a sister, or a daughter who's been diagnosed with breast cancer, your risk of having breast cancer is higher. If you have several relatives that are on your mom's side or several relatives, on your dad's side that have been diagnosed with breast cancer, that means that your risk of having breast cancer is higher. Now, this doesn't mean you're going to have it. That means your risk is higher, which means we just need to pay better attention to it. So, let's talk about risk factors we can change. So one of the risk factors is not being physically active or being obese or overweight. This is something that we can do something about. The second is taking hormones. There are forms of hormone replacement therapy, estrogen and progesterone used together, that are taken during menopause. If you take those hormones for greater than 5 years, that does slightly increase your risk of having breast cancer. Your reproductive history. If you're a woman who's never had a full-term pregnancy, if you have never done breastfeeding with your child, or had your first pregnancy after the age of 30 years old, that can increase your risk of breast cancer. And researchers have also found that patients who are tobacco smokers or heavy drinkers have an increased risk of having breast cancer. So, what are the things that we can do about these risk factors that we can change? The first one is one of the things I'm very passionate about. Let's get up, let's get active, let's exercise. Keeping an active lifestyle and exercising can help to reduce your risk of having breast cancer. If you are not a tobacco smoker, don't start. If you are a tobacco smoker, quit. Limit your alcohol intake. If you're a woman, no more than 1 alcoholic drink a day. If you're a man, no more than 2 alcoholic drinks a day on average. These are things that will help to decrease that risk. And then lastly, if you are taking hormone therapy, make sure that you're doing so under the advisement or supervision of a physician. I caution you for any over-the-counter herbal or hormonal medications. There are a lot of herbs and hormones that are out today, and I caution you to make sure that you are under the supervision of a physician if you are using any kind of hormone therapy. And then if you have a baby, try to breastfeed if at all possible. So let's talk about some of the, thank you, Mr. Cannon. Let's talk about the breast cancer treatment. So the first is surgery, and that just includes, hey, let's cut out the cancer cell. The second is chemotherapy. Chemotherapy are special medications that are used to help shrink or kill cancer cells. Those medications can be taken by mouth or through an IV or a port. The next is hormone therapy. Is a therapy that's used to help block cancer cells for getting those hormones that they need in order to grow. And then lastly is radiation therapy, which is similar to an X-ray where they use high energy X-rays to kill the cancer cells. What treatment plan is utilized for each person that's diagnosed with breast cancer is determined by their physician, their medical oncologist, in addition to a surgeon that may be a part of that team, as well as a radiation oncologist that will determine what treatment plan is best for them. So lastly, what I'd like to do is touch on a little bit about a specific type of breast cancer that's called triple negative breast cancer. This is a kind of breast cancer that does not have any of the receptors that are found in most breast cancers. These receptors are very important and key in some of the treatments, specifically the hormone therapy that we talked about before, that are used to help destroy the cancer cells. So that means that because this kind of cancer does not have those receptors, then that means there's a limitation in some of the treatment regimens. Chemotherapy is the one that's most commonly used, but what this means, because of those limitations, there's a higher risk of death with this kind of breast cancer. So let's talk about the treatment a little bit. The first thing they try to do is remove the cancer. If it's a lump that's in the breast or in the underarm area, they'll take the lump out. That's called a lumpectomy. If the breast cancer is so diffusely spread, they may have to do what's called a mastectomy where they take the entire breast off. In addition to that, chemotherapy is used to target the cancer cells that could not be seen with removal via surgery, or that may exist in other areas of the body. That's what they use chemo for. And sometimes they use the chemotherapy prior to the surgery to help shrink the cancer cell. So the lumpectomies, if a patient has that, is generally followed by radiation therapy to kill any remaining cancer cells. What treatment regimen is right for these patients that are unfortunate to have this diagnosis, again, is determined by their medical team. So what we want to emphasize today, though, is that early detection is key. That's the whole purpose for doing this Facebook Live today about breast cancer. I can't tell you enough how important it is for us to detect it early. So whether you're a woman or you are a man, I want to make sure that we understand and get that men can get breast cancer. So make sure, ladies, if you're listening out there, make sure you tell your husbands, your sons, your fathers, your grandfathers to make sure that they too are paying attention. If you have family history of breast cancer, I can't tell you how important it is to make sure that you have that consultation. I do understand that there are oftentimes are patients that are concerned and that are fearful for going to the doctor, because especially if they have family history, because unfortunately patients will tell me sometimes, hey, Dr. Celeste, I just don't want to know. However, how well a patient does after a diagnosis of breast cancer is one of the most important factors is detecting it early before it becomes a larger thing or before it's spread far further. Then that can help with the prognosis and how well that patient does. So let's make sure, if you have anyone that you think would benefit from this information, please feel free to tag them in the text and or in the chat. Tag them in the chat or share this information with them in any way possible. And thank you guys so much for listening. I see Miss Felicia Fortune. Hey, how are you? And Miss Yolanda. Hey, how are you? Thanks so much for listening. Please, please, please share this information with your loved ones, men and women alike, so that we can help to decrease the spread of this disease, because we have treatment modalities that can help these individuals. So thanks so much for listening. Have a great day, and we will see you on Friday when at 12 noon. We're going to do a special part 2 on our session about bullying, specifically in our teenage young ladies and young men. So thanks so much. Feel free to follow me on Facebook.com/Dr. Celeste MD, Facebook.com/DoctorCelestemD, and have a great, hey, my sister-in-law is watching. Hey, Joni. Follow me there, and we will see you on Friday. Thanks so much, Felicia. Thank you.